Hello, good morning to all of you from all over the world. Good afternoon or good evening, depends on which time zone you are. I am Oying Rimon. I'm the director of the Bill and Melinda Gates Institute at Johns Hopkins University and a senior scientist at the Department of Population and Reproductive Health. I am delighted to welcome you to this event, live from the Sheldon Hall of the Bloomberg School of Public Health. This webinar, Building Trust One Tweet at a Time, using digital media to build a strong, credible brand in the public health sector. This event is hosted by the 120 under 40, the new generation of family planning leaders. It is an initiative under the Bill and Melinda Gates Institute at Hopkins and sponsored by Bayer. In fact, the idea of this webinar came to us because we wanted to provide young leaders with training in social and digital media skills. We saw some of them, like one of our panelists here, Dr. Tlaleng, Mofokeng, who flew all the way from South Africa, were quite good at it. They wrote articles and blogs, were featured on radio and TV, and were often taking selfies and posting them online. And they did this all in the service of their work on behalf of women, girls, communities, and countries worldwide. Whether one uses YouTube, Facebook, Twitter, Tastemade, haven't heard that one, huh? Instagram, Snapchat, we can see the democratization of the opportunity for entrepreneurs to create their own unique brand and needs. It does not take a corporation anymore to create powerful brands. One can create one's own personal brand as a trusted source of information using entertainment education approaches. Of course, my own mentor on this is my son, who is the marketing manager at Trip.com, always tells me that I'm too traditional. Today, we hope you will learn from some new techniques and tips for using digital and social media to advance public health while creating your own unique personal brand. We also hope, and this is a commercial, that you will nominate a young champion in your network for the 120 under 40 initiative. Nomination for year 2 are being accepted, and the deadline is May 17. Go to 120under40.org to enter your nomination. And now I am happy to introduce Gus Sentementes, today's moderator. Gus is the Audience Engagement Manager at Johns Hopkins University, where he has grown GHU's main social channels every year by double-digit percentages, launched a live streaming program, and helped advance social media best practices around the university. Prior to that, Gus was an award-winning journalist at the Baltimore Sun for 12 years, covering business and technology among many topics. He's a graduate of Columbia University School of Journalism. Gus, take it over.
Thank you, Oying, and thank you everyone for joining us today here at the Johns Hopkins Bloomberg School of Public Health. Thank you to our online audience. If you're watching on Facebook Live at the moment, please take a minute to share this live video with your friends and family. We'd like to draw in more people who can engage with us over the next hour or so. We're hoping this could be an interactive discussion, and we're hoping that people will ask questions at the end that we can get answered. I am happy to be here, and I'm really pleased to be introducing 4 women who are stars in their own right, and they are really engaging in a lot of best practices in how to communicate in public health with social media. I think I'm just going to run down kind of quickly the framework of what we're doing here today. We're going to have four panelists, and they're going to each introduce each other for a few minutes each, 5 to 7 minutes or so. And then we're going to launch into a Q&A with all of the panelists that I will lead. And then after that, we're going to do a Q&A with the audience in the room and online. So again, we want to attract as many online viewers as possible. So please share. Please use the hashtag I think is 120under40webinar, hashtag 120under40webinar, and feel free to draw people in on Twitter. Before I get started, just really quickly, some personal remarks. I started off my career as somebody who believed in the power of mass media to inform people, to change their perspectives, and to change the world for the better. And that's why I went down the path of journalism as a career. And as I got into journalism, I became a little bit of a technophile and obsessed with social media. This happened around 10 years ago as Twitter and Facebook were really launching. And I really saw back then what democratizing power social media was going to have on our society. And back then there was a lot of optimism. You know, people were tweeting photos of their desks, and people were having tweet ups and things like that. And now, and there was a lot of sense that this could be a force for good. And now what we've seen in recent years is, well, there's a negative side to that. So we're going to cover both of that, both the good and the bad of social media, I think. And I'm going to prompt these questions from our panelists to hopefully address. So without further ado, we're going to introduce, let's see here, who's first? Okay, Laci, yeah. So our first panelist, Laci Green. She's a sex educator and YouTube personality from California. Her peer-led sex education series, Sex Plus, now has well over 1 million subscribers and viewers in all 196 countries. Laci also works with universities, conferences, military groups, and government offices on sexual health and sexual violence prevention efforts, and produces educational video series with MTV and Planned Parenthood. So welcome, Laci.
Thanks for having me.
Yeah. So I'm gonna, really quickly, I'm just going to share your video here.
Oh, hi, Internet. Oh, hey, Internet. Oh, hi, babes. Hey, it's a great day. Let's talk about lesbian sex.
Let's talk about sex, baby.
Hi, my name is Laci Green, and I created Sex Plus, a sex education series on YouTube. Let's talk about squirting, bisexuality. Everyone has a butt. Helping your girlfriend have an orgasm. Focus, Laci, focus. Since I started making these videos in 2010, my online community has grown to over 2 million people, which is kind of crazy. When I'm not making videos, I give talks at schools and universities. My top goal is to educate and entertain, of course. Orgasm and ejaculation are 2 different things. Orgasm, ejaculation. But also to help people feel comfortable, to understand that sexuality is normal. Let's talk about intersex, aka disorders of sex development. It's like the worst name for a cancer screening ever. No teeth, y'all, you could puncture it. Not the time to get kinky. Sex is a part of life, so let's talk about it. Whether the topic is silly and fun, as long as it's safe and consensual, it's perfectly okay. Or complicated and complex, I'm not afraid to go there. The explosion of dating apps is completely changing the way that we date. This is not a formula for sex. My name is Laci Green, and I make sex ed on the internet. So hey everyone, I am Laci. I started on YouTube about 10 years ago as a teenager, and I started making videos that was meant to disseminate information about sexual health and healthy relationships and a lot of feminist gender issues as well. And this was in response to my experience as a teenager getting abstinence-only education, which is my favorite thing on the planet. I didn't feel that was an adequate way to educate young people. And so I started my project Sex Plus to share what I was learning. And as I went to college, after I graduated from Berkeley, the project really took off. So like a lot of YouTubers who started in the early days before YouTube was the platform that is known widely as a place for viral videos about cute babies and cats, there was, a rather small community on there. And a lot of us who started at that point didn't really expect YouTube to become the thing that it is now, to have so much cultural significance and reach, which was a very, pleasant side effect of all of the blossoming of social media and social networks online. In my experience, YouTube is a really fantastic medium for people who are interested in disseminating information about public health and about a lot of different social issues. It's a great place to have a conversation, although it is not without its drawbacks. So I thought I'd share some of the things that have made it really great for me, and also some of the challenges that have come up in being a YouTuber and being a part of this conversation on platforms that are still relatively new. I think one of the biggest benefits that YouTube has to offer public health professionals is the fact that it's a very creative platform. This is a place for people to really be authentic, to express themselves, to have their own personal style and message. It's very personality driven. And that's really important because people are reached, people have these conversations in a lot of different ways. There's no one approach. And so a lot of different creative personal approaches, I think, is a fantastic way to go about it. And that's what YouTube has enabled me to do. I'm really into video stuff, and video isn't your thing. There are lots of different social media platforms that also offer the benefits of creativity. YouTube is also very community oriented. There is really tight knit communities. It's super interesting. It's expanded hugely in the last 5 years. But this is great because it makes these topics a conversation. It's not a lecture. You get to post these conversation starters, and you get to know your community from their comments, of course, which we all know how great internet comments can be, but I think YouTube does tend to be better than other parts of the internet. There's also other social media platforms, so the conversation continues on Twitter and Facebook. My viewers email me a lot because I talk about sexuality. People tend to want to have a little bit more privacy, so a lot of conversations happen one-on-one through email. And I also get to interact with my community through IRL, in real life events, visiting their schools, conferences, conventions, things like that. I also think that YouTube is great because it's very accessible. When I first started on YouTube, all I had was a webcam and Wi-Fi. I had downloaded just like a free video editor. It's very basic. There's a low entry point to starting on YouTube, which makes the conversation more accessible for people that wouldn't otherwise be able to be a part of this conversation. I also really think that YouTube, one of the great things that it offers that's unique to YouTube is that it is a multicultural platform. YouTube is a huge platform in many different countries. It's not just the United States. So there is sort of a coming together of ideas, backgrounds, cultures, and perspectives that you don't get as easily in real life. And I think for me, that's helped to strengthen my work. It's also strengthened my community because people get to hear lots of different perspectives. So that's awesome. That said, YouTube can be a little bit of a challenge at times. All the time, actually. I feel like, it's constantly this process of encountering new challenges and figuring out how to solve them. Some of the ones that come up a lot and that I hear people talk about a lot who are in the public health sector, really just any sort of social good, and they want to bring it online, is that people engage differently online sometimes than they do in real life. I think there's more license for people to behave in socially unacceptable ways online. And that's exaggerated when someone feels hostile, if they feel skeptical, if they don't have a really great in real life community around these things. So that's not good. It could be a fairly toxic environment, although there are ways to temper that. I also think that YouTube and social media, even though it is all about the conversation, it's not necessarily suited to nuanced conversations. You have a 4-minute video, you have a 140-character tweet, right? These aren't necessarily the best ways to have really in-depth conversations. So I think that for tough topics, being in person is still much better. It's preferable for some of the conversations. Another thing that's come up for me a lot, public health. Very politicized. I have a lot of feelings about that. I don't think this should be a political, partisan issue, but it is. So that kind of puts people on the defense sometimes. And I've had to learn how to navigate that and have made a lot of big mistakes. In the YouTube community, something that comes up and something that I think is worth addressing amongst public health experts is that people are posting content that is not fact-checked. Sources are not cited. So really all information is kind of equal, and that's not good when it's incorrect information. The last problem I come up against pretty commonly is that one size doesn't fit all. One way of approaching the conversation isn't necessarily going to be the best way for different communities. So you kind of have to figure out what the best approach is for the most people. I think that these problems can be overcome, and they come up, but there are solutions. Being patient, listening to your audience, trying to understand the concerns of people who are a little bit more hostile, and addressing them if you can. Try not to take people who get hostile personally. It's not about you usually. It's about what you're talking about or how you're talking about it. So keep focused on the objective, what you're trying to do, the message that you're trying to send. Don't get distracted and bogged down. I think a lot of people, it's tempting to sort of get caught up in that stuff. And the other thing that we can do is to reach out to the community, to cultivate our professional networks online so that you have support as you undertake this task of reaching the public. Thank you so much for having me. I'm looking forward to hearing from the other panelists. Sure.
Yeah, thank you very much. Thanks to all who are watching online. Thank you for sharing. If you have a moment, please share the live video and invite your friends and peers and family to join us today. Really quickly, I want to do a special welcome to the viewers who are part of the 120 Under 40 program. The program's goal is to recognize and galvanize the next generation of family planning leaders around the world. You are watching a special webinar called Building Trust One Tweet at a Time, using digital media to build a strong, credible brand in the public health sector. And it's presented by the 120 Under 40 Project of the Gates Institute. Okay, on to our next speaker. Okay, so really excited. This next speaker came all the way from South Africa. Her name is Dr. Tlaleng Mofokeng. Did I say that right? Okay. All right, I tried. I'm going to call you Dr. T because that's how she's known on Twitter. So follow her on Twitter. And she's traveled all the way from South Africa to be with us. She's a medical doctor at DISA Clinic, DISA Clinic, and a founding member and vice chairperson of the Sexual and Reproductive Justice Coalition in South Africa. Dr. T produces patient-centered health communication content focused on sexuality and relationships for young people. In 2016, Dr. T was named a winner of 120 Under 40. Welcome to Baltimore and welcome to the Johns Hopkins Bloomberg School of Public Health. Come on up.
My name is Tlaleng, and thank you so much for the invitation. I am a medical doctor, but I'm also a content producer and a sexual health clinician. I'm also involved in advocacy nationally in my country, but also globally, having recently been at the United Nations Commission on Population Development. You will see on the background some of the pictures and work that I have done over the years. And the shift from being a medical doctor into a health content producer and now an advocate for reproductive justice really happened early on in my career as an intern, where I'd find in the rural clinics, I'd have more young people waiting for me at the car in the parking lot than I did inside. And most of the times it was about sex and sexual pleasure. And it got me to thinking about how health systems are generally designed for disease prevention, but also illness. So there wasn't a space where young people could go to talk about sexual well-being and pleasure. One of the principles that I believe is that sexual and reproductive rights are human rights, and we should all be fighting to make sure that people have access to and protection to their reproductive and sexual rights. But that must be linked to healthcare services that are comprehensive, that have quality options, that then people can literally access services. And all of these are linked to then give us reproductive justice, because without proper adequate information, without accessible choices and options, even in family planning, people can't really be making informed choices, and therefore there is no justice for them. The online community for me really started off on Twitter, and it was interesting how all the messages initially were in the DMs, so privately. And over time, people were then confident to actually start sharing with me some of their journeys, some of their sexual frustrations and experiences on the timeline. And often we'd have targeted Twitter campaigns like Twitter After Dark, and we would speak very candidly about sex and vaginas and clitorises and orgasms. The themes of the content that I usually produce is mainly centered around issues of consent. Because I live in South Africa, and a lot of young women's first sexual experiences are through form of rape or sexual harassment. So it became very important for me, as I was seeing more and more patients after post-traumatic experiences, to actually start engaging with people on issues of consent. Do we know what that is, and why it's important? And also to navigate relationships. Often we take it for granted that we tell people say no, or demand that you use a condom. But when you're in a relationship with someone you love, it's not as simple as saying no and then walking out of the door, because you are in a relationship. So how do we give young people the language, break things down into bite size, and so that they can really truly be empowered without the adults having to be there? And I think that has been one of the most learning for me, was how do you take medicine and all these medical jargons and break it down in such a way that young people can identify and also be able to use that information. And also issues of family planning are very important for me because a lot of women generally have not a good relationship with their vaginas, only because there's a lot of myths already surrounding even the word vagina in an open space like this. It's not always one of those things that people just say, and you always get the stare like, oh, she just said the word vagina. So when you're celebrating it and you're encouraging women to touch their own vaginas and experience their own bodies, it is really groundbreaking. And why it's important is that a lot of health solutions are centered around our bodies, whether you're talking about pre-exposure prophylaxis, where you're looking at vaginal rings, whether you're looking at family options like the vaginal ring. If women generally don't have a good relationship with their body, it's going to be difficult to get them to opt for some of these options, which are quite modern and could be life-changing for some of them. I grew up with a mom who was always very open about sex. So I find talking about sex for me very easily. But it's always interesting to see how other people react to me when I'm open about sex. And that's always very telling. So I really do believe that comprehensive sexual health education is for everybody. It's for the minister, the president, policymakers, implementers, and for all of us who may not necessarily think we need sexual health education, but so much is changing in the world. And if you look at all the marginalized populations, whether you're talking about transgender individuals, you're talking about poor rural women, whether you're talking about sex workers, all of these needs are very different, and they require a certain type of response in terms of healthcare and solutions that center them, as opposed to other people who can access services. So it's very important for me then to produce content that can be specific for policymakers, for example. How do we make linkages between health and wellness and sexual well-being to policies that are truly implementing non-discriminatory and empowering of young people to make choices, and link that then to the type of service and organizations that we then run. So it's very exciting for me to be here today just to share my own experience and how I make the linkages between radio to print and to the YouTube videos that I produce. And what's really has been important for me is to maintain a very open, very positive outlook generally when it comes to sexuality, because I'm aware of having the medical background, the expertise that I bring to content production, but also I need to be accessible myself to the people that I'm trying to reach. And to amplify the message in the current global political space that we find ourselves having to operate at, it's going to take all of us to really galvanize and support each other. And let's not forget to take care of one another as well, because when you're in the front lines, it's very easy to feel very discouraged, because that's when you see, all the the bad decisions that are being made, and how do we then support each other into creating a world that we all know we deserve. And really, in a nutshell, that's what I'm about, and that's what drives me to do the work that I do over the years. So that's that.
Great. Thanks, Dr. T. Just while Dr. T was talking, as I was preparing for this session today, I actually did research on all our panelists and really appreciated the advocacy work of Dr. T and Laci Green in particular on Twitter and YouTube. As a guy, I'm going to date myself here, but as a guy in his 40s who's had 3 children and seen the childbirth experience, I'm still learning stuff. And I actually pulled up Laci's videos, and I was like, wow. When I had, sex education in high school, it was, they rolled in the TV with the VCR, threw the VHS tape in, and that was it, and nobody really had any questions. And here, this is real, everything is a la carte, self-serve, and so there's a tremendous opportunity in that. There's also a tremendous danger, because you can end up, picking out, wrong information or information that's accurate. So anyway, let's move along. So thank you, Dr. T, for that. So going to be inviting next to the podium, Christy Feig. She is the Senior Vice President of Global Health Strategies. Before joining GHS, Christy served as Director of Communications for the World Health Organization, Director of International Communications for the American Red Cross, and a broadcast journalist covering health and medical issues at CNN. Christy holds a Master's of Public Health from this school.
Yay!
Yay, go Hop. Right. So let me make sure that you're set up here.
All right, so we're talking about building trust today, and I'm going to approach it from an organizational level to see how we can build trust for the organizations that we work with, whether it's our own organization, where's my microphone, sorry, whether it's my own organization or somebody else's organization, because trust is the key to success with organizations. If I look back, for example, at CNN, if we have broken trust, people would have not believed anything that we wrote and broadcasted. They would go to another network. At the Red Cross, at the World Health Organization, if we had broken the trust of the people who follow us, they would not have taken our health advice. And that gets really serious if people don't trust the health advice that you're giving. So I want to focus on how communications can help build that trust and reinforce that trust. But, as I always told my teams, when we do this every day, what all of us do, communicate, 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 we will make mistakes. It's inevitable. What matters is how you handle it. And that's what we're going to talk about today. I'm going to start off with giving you a few little tips on what we have figured out over the years of how to determine your response. And it's important to say you need to do this now, not when the mistake happens. And fortunately, the questions that we tend to ask as we were going forward with trying to manage mistakes are the same. So pretty much whatever the mistake is, whether it's somebody saying negative things about you, whether you make a mistake and say the wrong thing, whether there's something factually inaccurate or reputationally risky, the questions tend to be the same. The first thing we look at is, do we need to respond? And to figure that out, we ask, will it get legs? Probably a broadcast term, but what I mean by that is, will it get more visibility? Will it get louder? Will the people that are talking about it, the people who are amplifying it, continue to grow it? If it's not going to get legs, you don't have to necessarily respond, but this is a really important question to ask, because there is a chance that your response will be the one that gives it legs. So look at that very carefully. Respond quickly, and you're going to see a great example of this in a little bit, because right after this we're going to go to examples and look at what went well and what didn't go well. Respond quickly. If you remember nothing else, remember that today. Get the tone right. Follow the personality of the organization, even when you're trying to correct something. And listen. Same reason that you listen on social media all the time. You're going to go in with the response the way you expect them to hear it. People don't always hear things that way. So you need to listen, are they hearing it the way that we intended, and if not, adjust the message. That's exactly the same as real-life social media. Okay, let's play. The American Red Cross is stellar at social media. It's one of the things, in fact, it was the front line of our communications when I was there, and it's only gotten bigger. In steady state times, it was all about building the networks, getting the champions in place. In emergencies, it was about listening to what was needed where and getting the resources to the right places. And in reputational management, we could pretty much shut things down in less than 24 hours, and we actually used to time it just for fun. So the Red Cross is very good at social media. Then this tweet went up. This is about a year after I moved to Geneva. Ryan found 2 more 4-bottle packs of Dogfish Head's Midas Touch beer. When we drink, we do it right. Okay, you're the director of comms at the Red Cross. How many of you say we should respond to this? Raise your hands. How many people would not respond to it? How many people would call me? They decided to respond because it was going to get legs, regardless. And this is a very serious, life-saving organization talking about going to get beer. That's a problem, and it will get legs. So the first thing they did, the person who posted it took the responsibility. Road treat from Red Cross due to my inability to use Hootsuite. So explain what happened there. The Red Cross acknowledged it and deleted the tweet, something that's a whole different conversation. We've deleted the rogue tweet, but rest assured the Red Cross is sober and we've confiscated the keys. They're a serious life-saving organization, and they went with a humor response. Does that work for you? Raise your hand if that works for you. Why does it work for you? Somebody just jump up and say.
It was an accident.
Yeah?
It shows that they are human.
Bingo. Both of those are exactly right. And one more thing. This is the tone, This is the tone, I'm used to roaming, that the Red Cross has built into their social media personality. It's a human tone. It's a real tone. It's a we're just like you tone. So it made it very easy to accept the humor piece of that. WHO could not have gotten away with that. But it worked, and it not only worked, it actually turned into a big fundraiser. Donate to Red Cross today. It started raising money, and it started raising blood supply. So, total win. This is when you know you've done it right. Social media is personal. This is your first lesson. Every organization has a personality. Stay true to it when you are responding to problems. Okay? Next one. This was a big reputational risk for WHO, and it's the reason they had to hire me in the end. In April 2009, a flu pandemic broke out. You may remember it. It was H1N1 if you're into those things. It started in Mexico and it spread pretty quickly. With travel, of course, it went across the globe. In the beginning, it was a high death rate. It was something with a reaction in the lungs, and it killed a lot of people. As it spread, it became less severe, for reasons I won't bore you with right now. The WHO raised the alarm when they first saw it come up. It takes 6 months or more to develop a flu vaccine because you have to get the exact strain, you have to grow it in eggs, these things take time. So they started that right away. They started having the companies produce flu vaccine. This was during the financial crisis in Europe, so every government is tight on funds. WHO is recommending that they start ordering the flu vaccine now. And then the disease got less serious. The criticism started on social media, as it always does, saying WHO called the pandemic because they're in bed with industry and they wanted to help the pharmaceutical companies raise money. Do you respond to that when it starts on social media? Everybody raise your hand and say yes. They did not. They were actually not on social media very strongly at that point in time. Senior leadership didn't think it was necessary. It didn't reach their audience. They're used to talking to governments, ministers of health, and health officials. They weren't really interested in real people. It was accepted as fact on social media because it was not rebutted. And it spilled over into traditional media. And 5 weeks after I was hired in December 2009, we were testifying in front of the Council of Europe. How you manage these things matters, okay? It's a crash course on WHO, by the way. So you don't get all the tweets because there were none. Luckily, right after this, they got the importance of social media and invested in a proper team, and now they're amazing. Lesson 2, perception is more important than fact. And if you do not correct inaccurate statements on social media, people assume it is true. Once it spills over to traditional media, you cannot contain it. It took us 1 full year to rebuild the reputation of WHO after this. Stakes are high. Buzzfeed, this is one of my favorites, because this actually proves a great point. This is something that happened during Ebola when our teams were working about 20-hour days. We had a great expert down in Monrovia at the time who was very good with media and talking to a lot of media. A reporter called him in the middle of the night. He assumed that it was a reporter he'd been working with from CNN. He, half awake, did an interview. The next day it was published and it was factually wrong. He called me up and said, they've misquoted me. I called the reporter trying to fix it. It was about USAID. USAID was now threatening to pull out of Liberia. The stakes were high. Now we're talking about lives. I know the editor well, so I called the editor, and BuzzFeed determined to stand by their story. We decided not to work with one of the reporters that was associated with this. We decided not to do interviews with them. Now, the way WHO's media list is set up, WHO doesn't choose who's on their media list. It's complete self-select. If you go to the link and sign up, you'll get all the press releases and everything WHO sends out. But my team was tired, and an email came in that said, hey, we're having trouble signing up. Can you help us? And one of the people working on my team at the time said, my understanding is that BuzzFeed is banned. Now, this started at 2 o'clock in the morning, this campaign that BuzzFeed launched. BuzzFeed is so influential and so good that you can't not respond to something they're saying. I think all of you know that. When she said BuzzFeed is banned, she accidentally left the BuzzFeed reporter on the email. Oops. They started a campaign against us at 2 o'clock in the morning. We'd just gone to bed. Luckily, one of my social media people woke up at 3:30 and woke me up. That ended up going into a full day of campaign against WHO. Now, there's a beauty to this. Miriam sent it to my personal Twitter. The trust of WHO is on its corporate account. We couldn't fix this, but our measure of success became a strategy to keep it on my personal account to protect the trust that WHO had with its followers. And we succeeded. So even though this went on and on, we accomplished our goal. Remember your long-term goal, not your short-term emotion. Was I happy that Miriam was pecking at me? No, of course not. But we were able to protect the organization, and that's it. Protect the mission, even at your own expense. So we considered that a success. You can find it very easily, the full story, online, because I keep using it in training, so it keeps going to the top of my feed. So just Google my name, you'll find it. One more. Remember the long-term mission, not the short-term emotion. Let me show you what happens when the short-term emotion takes control. MSF is one of WHO's biggest and most important partners in the field in an Ebola response. They work side by side. MSF's mandate is to raise their voice and push people further and to sound the alarm. That's what they were created for. And they do it very well, and it makes organizations like WHO better. Right after the outbreak was determined to be Ebola, so this was about April 1st, 2014, MSF posted this online. This is the most deadly strain of Ebola virus. It kills 9 out of 10 patients. Now, one of the things that we're very careful about in disease outbreak is creating panic. Because if you create panic, it can actually make an outbreak worse. It's a fine line to walk. My top spokesperson, who is one of the best spokespersons I've ever met, stands in the line of fire longer than anybody else and gets it right longer, got his emotion in the way. This was from his personal account, but because he was the lead spokesperson, there is no personal account. It's all professional. He responded, "Don't exaggerate. Ebola can kill up to 90% of those infected, and in this particular outbreak, the fatality rate is less than 67%. Does that matter? No. You're still killing 2/3 of the people. You know, the purpose was to sound the alarm to get the international community involved. But he kept going. And this is what took over. WHO official takes swipe at MSF over Ebola severity. That was published about 4 hours after this fight started. And it never went away. This is October of that year. This is May 2015. This one is March 2015. It plagued us through the entire outbreak. This is what happens if you forget the long-term goal and let your emotions take over. There's your 3 lessons. Social media is personal. Every organization has a personality. Keep it when things get bad because it works. It's why your people love you. Oh, that's interesting. They all went with 1s, didn't they? Really, you should proof your slides. Perception is more important than fact, and time is of the essence. If you do not correct inaccurate statements, they will spill over to traditional media and they will be accepted as fact and you will not be able to get it back in a box. Remember your long-term goal, not your short-term emotion. When the stakes are high, protect the mission even at your own expense. That's my best advice for you. I could do a whole nother presentation on how do you rebuild trust after it's been broken, but I'll spare you that one today. Thank you.
Thank you so much, Christy. That was a brief master class. I was in the audience. I was like scared to raise my hand. I'm like, I don't know what I would do. So really challenging questions for an organization. And just to really recap here, that what's great about this panel is that we have people who are sort of individual brands and individual voices joined together with people who have experience working with large public health brands. And so we're getting some good insights here from these people. So moving on to our next guest speaker, I'm going to be introducing Marissa Russell. Did I say your name right? She's a social media specialist at the School of Public Health. Prior to her employment here, she interned at CNN, providing social media coverage of the first 2016 presidential debate and transforming on-air content into social media content as part of the social TV team. She is pursuing a master's degree in communications with a focus on social and innovative media at Syracuse University. Welcome to the panel.
Sorry, I forgot to take my badge off. Hi, thanks for having me. So I'm actually going to step back a little bit from building a public health brand necessarily and teach you some things that I've learned as a student and working here at Johns Hopkins School of Public Health. We have a huge audience. We're talking about a lot of things from malaria to reproductive health to environmental health. So I just want to talk about some of the basics and how you can build your brand on social media, regardless of what you're discussing. So this is one of my favorite quotes that just tells you social media is huge. It's incredibly important. And at this point, it's 2017. If you're not on social media, where are you? Who are you talking to? And how are you reaching your audience? So it's a great way to talk to people one-on-one, to really build that personality like Christy was talking about, and to build your brand and to connect with people, even if you're not one-to-one in person. So 5 simple steps, 5 ways that I tend to break it down, and some things that I've learned about defining your brand. Branding yourself, deciding what you want to talk about, determining who your audience is, and then how you're going to reach them. What methods are you going to use? What platforms are you going to stand out on? Creating a strategy, and then planning your content, not scuffling every morning to post on Twitter and Facebook, but rather being prepared for those crises. And then analyzing how successful you are. And that's one of my favorite parts is the analytics. I'm a math nerd at heart, so I'll talk a bit about that too. So the first thing is really having consistent imagery. So here you'll see Hopkins School Public Health, our Facebook page, and our Twitter. And I could show you all of the rest too, but they look identical. We have the same profile image and we have the same cover image, and we change these for things like the Centennial and other branded events where we want to brand ourselves in a specific way for a specific event. Our bios and what we're talking about look very similar. We always use our tagline, protecting health, saving lives, millions at a time, because that's how people know us. That's what people know we are going to talk about. So we say have the same photo, use a professional photo. Obviously, don't use something that you wouldn't want out on the internet. What is on the internet is on the internet forever. I shouldn't have to say that, but I will. Use a clear font in your imagery and have the same name. So it's a really easy website. It's called NameCheck, which is namechk.com. You can look up any handle that you want, and it will tell you on every social media platform that has ever existed if it's available. So you can look and you can check if it's available on the ones that you want to be on. And it's really important because if somebody looks you up on Facebook, you want them to be able to find you on Twitter, find you on Instagram, find you on Snapchat, and not have to work at it. To be honest, if somebody has to work at it, they're probably going to give up looking for you, and that's not something that you want. You want to be at the forefront, easy to find. And the next thing is really defining who you are, determining what you want to talk about. So if you're going to talk about reproductive health, figuring out your niche, figuring out what your passion is, and really what you're going to stand behind. So I always think it's important to create a mission statement. I think we should create mission statements for who we are as people, but the brands that we are online. And creating that mission statement, it's not something that you have to share with the internet, but I think it's something that really grounds you back to what you're talking about in times of crisis. You can really look back to who am I, what am I talking about, and what's really the most important thing. And that kind of helps you reground yourself when you need to respond to things or when you need to just take a moment and reflect on what you're doing. So defining what your brand is about, this is one of my favorite profiles. She's actually one of my professors, and she really just talks about who she is. She's talking about advertising, she's talking about native content, and she tells people, this is who I am, this is what you're gonna find on my profile. It's a very easy snapshot, and it's simple for people to find. So I think it's important to really tell your audience what you're gonna be sharing. Whether you're an organization like Hopkins and you have a tagline, we share that. Whether you're the World Health Organization and you have that personality, make that known so people can easily determine what they're gonna read when they come to your page. And even if you're just a brand and you're speaking for yourself, stay true to yourself. Don't let somebody really take you down a notch. And the next thing really is finding your audience. So on social media, people are where they want to be, and they're not going to move to find you. So I think it's important to meet your audience where they are rather than asking them to meet you. So if you're trying to reach a young audience, reaching them on Facebook might not be the best way, but reaching them on YouTube or Snapchat is another way. So it's important to really determine who you want to reach. And answer these questions for yourself. Write them out on a piece of paper, write them in a Word document, and return to that at the end of the day or the end of the week or the month. Why do you want to reach them? And this goes to your mission statement. Why do you want them to know what you know about population health, reproductive health? Why do you want them to know about sexual health? And what do you want them to take away from your brand? And where are they? Are they on Facebook? Are they on Twitter? What are their interests? Where are they living? And take that all into account so you can go on your social media profiles and really take a look at that and make an informed decision about where you want to be most prominent. You don't need to be on every social media platform to be a branded expert. And then this is a big thing. How do you create content? So we are not all CNN. We are not Buzzfeed. We cannot mass produce content every single day. We don't mass produce content here at Hopkins every single day. So some of the biggest things to remember are you don't have to do that to have a strong social media presence. You have to have a brand, you have to have expertise and an opinion, and you have to stick to that. So some of the things that we do here, we create our own content. We have press releases and a magazine. We have Global Health Now. We have many options for creating that content and sharing it. But we also collaborate with others. So this is an example of an op-ed that we shared that was published from Bloomberg View by one of our professors. So we share the expertise and the work of our professors and the people that we are representing. So you can do that as well. You can follow, other professionals in your field. Like they said before, we have to stick up for each other. So help boost those brands, help boost people that you really are passionate about. Follow them, engage with them, share your followers' statements. If they're interacting with you about sexual health or reproductive health and they have a strong opinion or a strong statement, share it, add your opinion, give your feedback. That will really help you build your audience. And the other thing is to remember is you don't have to be 100% professional. You can, share some of your personal life. You can share your work in the field. Most people go by the 75-25 rule. For every 3 things you share professionally, share 1 thing personal. But it's really about how you make it. But just make sure that your brand is identified and that people know what they're expecting when they come to your page. And then I always go back to this. If you don't know what to share, think about what you would want to see. You're the professional, you know what you're talking about, you know what your brand is, so what do you want to see on another professional's page just like yours? And then to me, being a social media professional and working in the field every single day, a big part of my job is planning and scheduling content, so I don't have to worry every single day whether something will go up on my page, whether a video will go live on our YouTube. We can plan that out and schedule it. So there are various different ways to do that. We use a paid service, like many organizations, but there are free services like Hootsuite and Sprout Social, and Facebook as well offers its own scheduling platform that's down here on the right. So you can look it up, you can reach out to me if you have questions, but it's really important to create that plan and to create that schedule. Otherwise, you're going to be very overwhelmed, and social media does not have to be a full-time job, regardless of what other people think. It is my full-time job, but it doesn't have to be yours. And then the last thing that's really important is that you step back at the end of every week or month or 3 months, whatever you determine necessary, and really look at what you're doing. Is it working? Are you reaching the audiences that you want to? Are you on the right platforms? Are people engaging with you? And you can use very simple tools. All of the social media platforms have analytics tools. They all have, guides and different tutorials. Hootsuite has its own academy that you can take and get a certification in for free. And just ask yourself those questions. Are people engaging? Measure those results and determine, are you reaching your goals? I think it's always important, regardless of whether you're running a personal page just to talk about your morning commute. Are you, achieving what you want to achieve on social media? And these are some examples of what the analytics tools look like. These are ours, so they break it down a lot more, and we have a large following, but even on your own, you can see where you're going. And then last but not least, some of my favorite tips and tools, some books that I really like, and the last few are some resources that I really enjoy using. And my favorite final quote, social media is 100% a marathon and not a sprint. This goes with your long-term goal and short-term emotion. Just like Christy said, you have to work at this, and it's not going to happen overnight, but really stick to it, and you will be a pro. And feel free to reach out if you have any questions. Thank you.
Thank you, Marissa. And Laci, are you still with us?
Yes.
Awesome, great. So I wanted to start our panel discussion here in a moment. But first, I wanted to thank you all to the new viewers on our Facebook Live. Please take a moment to share this session today. It's a special webinar put on by 120 Under 40. This seminar is called Building Trust One Tweet at a Time, Using Digital Media to Build a Strong, Credible Brand in the Public Health Sector. And as we go into our questions for the panel, I wanted to remind you there's a hashtag 120 Under 40 webinar, and feel free to ask questions in the Facebook Live, because we're going to try to get to those questions at the end of the panel discussion. So for the first question, Laci, I'd like to start with you. So, your videos have been seen by millions of people around the world, and you've been on YouTube a very long time. The question for you is, what do you think you really owe your audience reach, and what's been the secret recipe to your success as a public health communicator?
Secret recipe. I feel like there's not, any particular formula. There's a lot of things that have gone into making my series successful. Part of that is obviously just pure dumb luck being on YouTube in the beginning. And, that's actually a lesson learned. When there's a platform that's starting to take off, getting on it in the beginning is the best way to be able to grow your audience. But in general, I think one of the main things that has been driving a lot of my audience growth is crafting an effective message, making sure that people are getting a high return on their investment of time in watching your videos. And every audience is different. For my audience, and what I've tried to craft is having very high amount of information packed into a bite-sized piece that has humor and personality and is fun to watch. And that's hard to do sometimes. I can't tell you how many videos that I've thrown in the trash because they did not meet my standard of what I think should be on my channel. So I very, very carefully curate what I put online and make sure it's really high quality stuff that I would want to watch, as someone mentioned earlier. I also think it's really important. A big part of my success is being authentic and just being myself. I am a human being, and I have that advantage. I think it was Christy that was talking about the advantage of being a human versus a company or an organization. That gives me a little more leeway. And I think that's nice. And I think it's great when organizations can try to capture that essence, to be authentic, to really connect with people instead of being this sort of abstract idea, this big bureaucratic institution. And I also think, again, accessibility. Accessibility is everything. We have to speak the language that people are speaking. We have to understand how people are talking about these things to engage in a way that people can understand. I think in academia, there's a tendency to get a little, and even, when I'm writing essays and stuff, to get a little lofty and not really speak the language that people can hear. So I think that that's really important for YouTube virality as well.
Flip side of your career so far in social media and on YouTube is, the reality of you're essentially a public figure. A lot of people know you, and a lot of people disagree with you. There's crisis, there's conflict, and I'm wondering, how do you handle public criticism, and is there any advice that you can give those of us in the audience and on the panel about developing, I guess, a thick skin? What are some strategies that you've employed over the years to really develop that thick skin?
Yeah, I think there's a tendency, we're human beings, we have egos, we have feelings and emotions, and it's important to be aware of those feelings and to sit with them and to handle them offline, not to bring that stuff online into your work as best you can, right? So being aware of that. And also accept that criticism is a good thing. It's unavoidable. It's good to listen to. It can be helpful feedback, even if you disagree with the criticism that's being levied at you. It's really important to try to develop an important or a healthy relationship with the criticism and backlash that you get. I can't develop a healthy relationship with all of it because sometimes it veers into kind of an abusive harassment territory, right? But for the stuff where I'm actually getting good feedback, I think it's important to engage with it. It's part of the work, and it's part of being online, and it makes me better at what I do, I think. In terms of building thicker skin, well, that's tough, it's a human thing, but I think having a good support system helps, and hashing out your ideas, kind of letting go of your ego best you can, and also picking your battles. I see a lot of the time people kind of get sucked down this rabbit hole of petty stuff, kind of nitpicking and not really focusing on the original issue at hand. And I think that can be detrimental and distracting and hurtful when it doesn't need to be.
I think, you talked about these IRL experiences, these in real life experiences. And I think I wanted to get a sense from you, what is online trolling is really common, and I'm wondering, what is your experience when you meet people in real life? Are just people nicer? I mean, do you see this real sort of difference between online behavior and IRL behavior, even from people who might be critical of you? Are they critical of you online, but as soon as they meet you, they kind of get friendly and want to buy you a beer? Or, what's the disconnect in your view?
Yeah, that's exactly it. You captured it perfectly. I mean, people are much nicer in person. They don't have nearly as much vitriol. And I think part of that is when you're in front of someone, they realize, oh, you're a real human being. You're not just a symbol of this or a ideologue or something like that. They realize that there are people behind the screen. And I think it's easy to forget that when people engage digitally with these ideas and not enough in person.
Thank you.
Sure.
We're going to switch over to Christy. Going to put you on the spot. So you talked about the issues of crisis and conflict in your presentation, and and I wanted to ask you and you talked about remembering your long-term goal and not your short-term emotion. If you personally or your organization tweet something that you later regret, do you delete the tweet? What is sort of like the best practice in your experience? Do you try to erase, whether it's a tweet or a Facebook post? Do you erase it from social media? Do you leave it out there? How do you manage that after the fact?
Thanks, Gus. I think it's probably could be different for personal versus an organization. For an organization, it's tricky because a lot of times the trust can be altered if you're starting to delete things. I mean, you saw Red Cross do it there, and they did a tweet about deleting the tweet. That's one way that it can work. For WHO, for example, we've got a situation where people trust us, and if they see us deleting things, they're going to wonder what else we deleted. So it's always a very lengthy discussion before we do anything like that. And it's like when Photoshop first came out, I can talk about that because I remember when Photoshop first came out. When Photoshop first came out, there was a big frowning in some organizations about using it in pictures that you put on your website, because the concern was, if you alter this, what else are you altering? That was the premise behind that. In an organization, that can often be the case with deleting a text. What else are you hiding from us? Because one of the biggest keys for building trust is transparency. And that's why Red Cross could do it and talk about it, and it worked because they were transparent about it. Does that help?
Yeah. I think what I've also seen now, and I haven't seen this really from brands as much, but I see it from individual journalists now, where they tweet something and maybe it's erroneous information, but then in the next tweet, they're going to say like, hey, everyone, I shouldn't have tweeted that. I'm going to delete this tweet. And then they highlight it. They call themselves out essentially. And then they take they delete it. And so there's a record of that disclosure that they're deleting the tweet, but they're not leaving, especially if it's an erroneous, factually incorrect tweet, you just don't want that getting out there on its own. You want it out of the stream. So, Dr. T, I don't know if you've had any experience with that. Like, you're a personality, an advocate. People know you. How do you handle, this sense of making a mistake out there? What do you do? Do you delete it? Do you explain it?
I think because my content is health information, because it's coming from a doctor, I literally have to think quite a lot before I tweet, and that's why I plan a lot, especially if you're doing a campaign, so that I do a bit of a throw forward or a build up. So I will often lead with an article or a link to the latest research or one of my vlogs, just to set the scene and the context before launching into opinion and information. And in my context in South Africa, telemedicine is not something that is encouraged. You still have to see a patient, physically examine them, take a history, and make a proper diagnosis with investigations. So for me, when I interact on Twitter, people know that I'm giving them health information to then empower them to go see their usual doctor to then have a proper consultation. So anytime I'm doing a campaign, I always develop social media toolkits that help, and it's always very well thought out. Of course, Dr. T comes through a lot in a lot of the things that we speak about, and most of the time when we are talking about sex and orgasms and vaginas, there is a very clear distinction between myself as Tlaleng, and when we're doing very specific, health information topics, I usually do lead up with research. I mean, one of the interesting things that's happened is, I was
being quite critical about one of our national department's campaigns that was targeted at young girls. And the background was that, gender-based violence and all the things that they need to do to decrease that. So I was being quite openly critical, and I got a call from a radio station to say, well, how much do you know about, what you're tweeting about? And I said, well, I'm tweeting about it. I think I know pretty much, So I don't tweet things I don't know about. So people know that if you see it on my timeline, it's because I know something about it. And I think that's what has happened throughout the years to build that trust. So I think as a health professional, for me, what's really important is the evidence-based research and linking that up with whatever information then comes.
Yeah, I mean, I think your discussion right now leads me into my next question for you, actually, because I think many of us are curious, having you representing South Africa and public health communication there. What kind of challenges do you face as a woman in South Africa? You're putting yourself out there, you're challenging the status quo for sexual and reproductive health and rights in social media and digital media. What kind of criticism do you face? How do you deal with it online? How do you deal with it in real life?
It's very interesting because online, I found myself in a very growing space of young Black women who were just finding themselves so liberated to talk about our bodies and everything that happens in sexual pleasure, which is a very big part of what I do. And so on online, on Twitter, we really have a good, close community. Every now and then you'll get your usual trolls, which I choose not to engage with, only because of my professional I suppose, brand, but also as myself, I really don't believe in feeding, deliberate trolls. So I've become very good at spotting those. And some people do make genuine mistakes. And, when you share a link or you point them to a source, they're quite receptive. In real life, where I found some of my biggest challenges have been on occasions where we're discussing policy with policymakers, in some of the national departments, where we find ourselves still being too overprotective and being too paternalistic when it comes to health information and content aimed at young people. So how do we, get the policymakers to be on the same wavelength as the patient, the end user, or the person who's the target? So a lot of the criticism, or I suppose a challenge, is actually on that level. But when it comes to social communication, it's quite clear when it's me just being myself and when it's health information.
Yeah, and my quick follow-up to you, as being seen as you're a doctor, is how do you deal with patients one-on-one? It sounds like you're developing this really outspoken public. You've been developing this public persona. People know you're on Twitter. I think you're on the radio as well.
Radio, yeah.
So, what is that relationship like with one-on-one patients? Do they ask you like, hey, don't tweet about this, or like with that sort of patient confidentiality thing? Do you how do you sort of manage that part of your personality, your persona?
Yeah, that's very good, because it actually goes back to medical ethics and your oath that you take. One of the very first things is that as a doctor, you are taught how to keep secrets. So I know how to keep lots of secrets, and there's no accidental, mentioning on things on the timeline. I mean, I chat with people in the DMs or inboxes all the time that on the timeline we actually don't interact at all. And that's the beauty of Twitter and social media, is that there's very clear lines between what's private and what's public. So when someone asks me something on the timeline and I know the answer may expose something more and deeper, I usually respond to them directly on the on the DMs. But if they put it on the timeline, then I know that by putting it out in the open, then they would like me to answer them in the open. But I do use my discretion. But I think medical ethics is very important, and to understand the limitations in your own country. Like with me, I know what I'm giving as information. It's not diagnosis, it's not treatment plan, it's not prescriptions. And I always tell people, when you see your doctor, ask them 1, 2, 3, 4, or have you thought about something else, and just to really help them seek help better. And I think that's what's really important. So in real life, in consultations, some people will ask you, sometimes they don't know, they just hear the voice from the radio and they'll say, were you on, so-and-so radio station? I said, yes, that's me. They're like, oh, okay. And then you have like a 10-minute of debriefing and then you start the consultation. And it's interesting how I'm seeing more patients who are well as opposed to ill patients, because now people know they can come and speak to me about how to get an orgasm or, sex or baby making sex, for example, when you get couples coming for therapy. And that's what's been exciting for me. It's how my medicine has changed from being around disease prevention and illness to now about wellness and how do we maintain well-being.
Yeah, yeah. Thank you. I think what we're seeing here about this panel too is, with Dr. T and Laci, they have this strong individuated digital brand. Their voices. When you Google them, when you follow them on Twitter, you see in their biography, their about section. You know what they are. You know really quickly what information they're going to be sharing with you, and so you know what they're all about. And what I see with Christy and Marissa is they're involved in that larger institutional brand communications effort on the public health front. And I wanted to ask first Marissa and then Christy, starting with Marissa, how do you handle sort of that voice consistency and authenticity, as when you're communicating as a large public health brand? I think what's also different with something like the School of Public Health, Johns Hopkins University, WHO, American Red Cross, these organizations have so much going on. They have multiple missions. It isn't just sex education. It is so much going on, and it can be very fragmented. And so, how do you handle that from a central communication standpoint? An authentic voice, something that's still human, but also covers the breadth of an organization. Marissa, let's start with you.
That is a really good question, and part of my everyday work here. We have 10 departments and over 60 centers and institutes, so filtering out all of the work that those people do is a challenge. But I think at the end of the day, we return back to our mission. Regardless of what the centers and the departments are doing, they are protecting health and saving lives. And it's almost billions at a time at this rate. And so we always fall back to that. We always also fall back to the fact that we are an institution and we do take an institutional standpoint. So our voice is a little bit less human in some respects because we can't, sometimes we can't take humor to it and sometimes we can. It just depends on what we're talking about. And we have a team and we consult with one another. It's not just me doing it every day. We are back and forth all of the time. I sometimes reach out to friends, other professionals. We consult with communications people within the school to make sure that we are relaying the information correctly. And if we do relay something incorrectly, that we are making that heard. Deleting tweets and all of that, it really depends on the circumstance. If something is factually incorrect from an institutional standpoint, it needs to be corrected. And if that means deleting it and reposting it and restating the research, that's what we need to do. And, we are not the research experts. We are sharing the voice of the research experts. So we rely on the professors and the faculty and the students to really tell us what they're doing, why it's important, and what's correct. Sorry, I lost my train of thought. But the other thing is when it comes to trolls and people, following us, we have millions of followers, so we do get a lot of that. And especially in public health and like people were saying in work of social good, sometimes people have a different perspective and you're giving them a perspective they've never heard before. And so for them, it might be the first time that they're hearing about vaccines or they're hearing about malaria or they're hearing about reproductive health. And sometimes they need to make their voice heard. And a lot of times on social media, that's what people want. They want to be heard, they want to be recognized, and sometimes that's all they need. They don't need a response and they don't need a dialogue. So for an institution, we don't often respond to those criticisms unless, like Christy was saying, they are going to grow into a massive issue. Then we will take a statement, but that's a different issue when you're talking on behalf of a dean and thousands of faculty and staff members. So it's a lot of discussion, a lot of communication. It's never one person tweeting one thing about one topic. We're always working with a large team, and we rely on that team to do it correctly.
Thanks. Yeah, Christy, what do you think?
WHO is actually a really good example for this because they work across 50 or 60 different health topics, all out of different departments. And when I first arrived there, the communications was completely decentralized. And so it was not unheard of for the organization to be sending out 3 press releases on the same day. There was no coordination with that. Luckily, they had not gotten strongly into social media and all those different departments. So we centralized communications at WHO pretty early on after I arrived. And one of the key pieces of that was exactly for what you said, keeping a consistent voice for an organization that diverse, so that we could actually recognize every day how we were positioning the organization. The different technical departments, the central team would represent all the work across the organization. And the different departments would come to us and say what they wanted out on which days. Then the departments did start getting, as you would expect, interest in having their own social media accounts. The trick is, we tried it in some places. The trick is we would have a department that had an intern that was really into social media. So they would go ahead and open up their account, then the intern would leave. And it's a reputational risk because it looks like WHO no longer works in that technical area. And that's the concern, because anybody can break the trust of the organization, and they can break it overnight, and it will take us years to build it back. So we kept a small rein on, or a tight rein on that, if you will. We decided that the head of the department could have a social media account with their name to it, so that when they left the organization, it's clear why that conversation stopped. It also positioned them as the health experts that they are. And that was another benefit for the organization. So you could have your head of TB having Mario WHO or something like that. And he could have those real technical conversations, but never to a generic department because of the fact that you could lose it at that point.
Yeah, yeah. When you work for a large organization, if you work public health or any corporation, these types of discussion of how do you give the keys to social media accounts, that becomes a part of daily administration, and so that's a real reality. And so, but again, we have we do have Dr. T and Laci, who are these individuals with powerful voices. And I wanted to start with Laci. Laci, you've been on YouTube now, I think about 10 years or more than 10 years?
10 years, yeah.
Yeah, I was wondering, how has your individual brand, and by brand I mean what you think people know you to be all about, how has your brand evolved in that 10 years? If you had to give just 6 words to describe what your brand is now, or just sort of how also it's evolved over time, I think we'd be interested to hear how you've really kind of grown and evolved as someone using a platform for 10 years.
Yeah, I think the bottom line for me is that it started as an outlet for me personally, to sort of have some conversations and get some emotions out. And it evolved into a platform that I do for other people. And it's sort of this mission to get people involved in the cause of sexual health, gender equality, and an invitation for them to be a part of that with me, rather than me sort of healing through my video diary.
10 years. Do you see yourself now in a position that you saw yourself in 10 years ago? If you were to look at you now with your eyes from 10 years ago, we'd be like, yeah, that's really what I wanted to be, and that's where I wanted to be. You
mean in terms of?
Just in terms of who you are as a public health communicator. Did you think you would go in different directions, or is this what you expected to be?
I did not expect things to evolve to this point. And I didn't expect YouTube to be this popular. I don't think any of us did. But I did plan to be an advocate for this cause. I just didn't really realize in what capacity I would be an advocate for these things.
Yeah, great, thank you. And I wanted to ask a similar question for Dr. T. How has your brand, your individual voice evolved, I guess, on Twitter? How long have you been on Twitter, by the way?
I've been on for close to 4 years now.
Yeah, and how have your use of the platform, how has it evolved from when you first started using it and engaging people to how you're using it today?
I think it's time. I mean, I started literally with just my phone and data, and just interacting with, people online and just being responsive. I think the main thing for me, and it's a principle that I adhere to all the time, I don't just post and go. I post and we digest and we break things down and we share and we learn. And I always, encourage everybody else to be positive when we do engage with each other, because often enough you'll find someone tweeting health information which is grossly inappropriate and most of the time inaccurate, and you'll get someone else tag me on the other people's tweets, and I don't engage that way because I'm aware that I also can't be a weapon, for example, or the headmistress who walks around with a stick online to say, well, actually that's not the truth. And oftentimes you can see that and you almost want to say something and do something, and it's actually when not to say something. I think for me it's very important. So in terms of the health content and sharing, being responsive is very important, on time, in real time, and often I've had emergencies on Twitter. People ask me, I've been raped right now, it just happened, what must I do? So that has forced me to then form networks with other departments, so I've got one of the brigadiers on my phone, because when I do have an emergency like that online, I know where to refer people to. Psychologists, social workers, in terms of the coalition, the Sexual and Reproductive Justice Coalition, we have a team of researchers too, so maybe I may very quickly want to react to a news breaking health event, but I need some research and data. So I've got people that I can then call on, and it means then your information is always accurate. And what happened in real life, in fact, is when, just randomly shopping, and a woman's partner came to me and said, Dr. T, you're the one that's telling all our wives, and then he went on and on about, the vagina and orgasms and how, women are so free now. So he says, yeah, because every time I ask her to do something, he says, Dr. T said, So I thought, gosh, okay, now I need to really start thinking and be very responsible, in what I say. And I was actually quite grateful for that moment, because I think often we underestimate, the power of what we say and how much that carries. So, I was very grateful for that interaction, because it made me remember that, for some people, that's all the health information they will get on a certain topic, and I really have to make sure that, what I mean what I say and say what I mean. And I think having an extended network of people, other professionals that I can call on for research, for data, for opinion helps a lot.
Thank you. I'm going to move this with one last question, then we'll open up to a couple of questions from the audience. This is sort of asking each of you for one piece of advice for someone who is just starting out in public health communications and wants to use social media. If you can, blurt it out, like one sentence. Marissa, starting with you, what would you tell people right now?
Don't be afraid. Don't let people who are attacking you or differing from your opinions keep you off of social media, and really stand up for who you are and believe in the brand that you're putting out there.
Thank you.
I would say listen, listen, listen. The best communicators listen more than they talk.
And mine will just be stay in your lane, know what you're talking about, and like I just said, say what you mean and mean what you say.
And how about you, Laci?
It's all great advice. I think my advice would be to not give up if you don't see immediate success, because building a digital brand takes quite a lot of time and consistency.
We have time for one or two questions from the audience. If anyone wants to jump up to the microphone, we'd appreciate it.
Yes, I want to thank all the panelists. Excellent presentations, clearly important work that you're all doing. I have two questions for Dr. T and for Laci. One is, do you know whether your messages are reaching outside of your countries, beyond South Africa or beyond the US? And if so, what's your experience with that? Are the same issues coming up regardless of geography? And then you all have mentioned the inaccurate information that is in social media, and clearly that's a big problem, especially in sexual reproductive health. I wondered whether you are able to refer to websites that might provide accurate information, if that's a useful strategy.
Laci, did you hear that?
Yes, they did.
Okay.
Dr. T, do you want to go first? Or would you like me to?
You can go first.
Okay, mic's to you.
Okay. Sorry, just gathering my thoughts here. So your first question was about whether my viewership's outside the U.S. And yeah, my viewership's we have viewers that come in from every country, all of them, which is kind of crazy to me. I didn't even know that was possible. Apparently it is. So the issues that come up with that, the main thing that comes up for me is sometimes my message, my tone, my approach doesn't have cultural relevance to everyone. So, and that's impossible to do. That's a barrier that I don't have a solution to. But it is something to keep in mind. And hearing from people who come from cultures where sexuality is much more taboo than it is even here, it gives me a framework to help reshape how I approach it to make it maybe a little bit more accessible to those people. But I am limited in my reach there. And then in terms of good sources, something that I talk to my audience about is making sure that the information they're getting comes from, I like to go straight to the source, peer-reviewed research, PubMed, the CDC, WHO, all of the top health organizations. And when possible, I link people to that stuff. I always cite my sources and try to be an example for other creators who are making content on YouTube, to let them know it's fairly easy to cite your stuff. Just put it in the description. Make sure we're fact checking. We have a responsibility as people who are in the public eye to make sure we're not spreading misinformation.
Thank you.
Thanks. So for me, I've made lots of connections across the world, mostly in sub-Saharan Africa, countries like Kenya, Zimbabwe, also in the UK and USA, of course, all my friends. So I see some of them in the room. And funny enough, New York, that's where I seem to be talking to a lot of American friends and colleagues. And of course, Baltimore, important for me. Of course, with the 120 under 40, there's always content that I share, across, especially on Twitter and on Facebook, where other colleagues are doing similar work, like in India. And for me, one of the frustrations, particularly in South Africa, was the lack of comprehensive sexual and reproductive health content that was sex positive. So hence the need to produce my own videos so that I can actually direct people to use. So I found teachers use them a lot as icebreakers in life orientation classes. Peer educators use them a lot also. And I just give enough of a skeleton so that then people can add on. So that helps a lot as a reference point. But like Laci, I do WHO, especially for country-specific issues. CDC is also a big one. For me, what I have to be careful about being a doctor who's practicing is the issue of endorsement and product placing and all of that. So when I do give links or give specific advice, I will usually do it privately, because then we can really, have that one-on-one interaction with the person and really understand what it is that they need. It's almost like a referral. Some people think they have a headache because they just always having migraines, but you never know if that headache is a source of something else bigger. Mm-hmm. So, so for me, I always have to be careful in terms of endorsement and, where I direct people to. So in that case, I always say, speak to your regular doctor, or of course, if it's something that it's accessible and easily found online, I can always direct people to a news clipping, for example, if they need to understand more of context. But the main thing for me is the balance between a health communicator and still being a practicing doctor in terms of endorsement.
Thanks, Dr. T. I think we have a question from Facebook.
We do have a question from Facebook. This question is from Hugo J. Sanchez, and he says, recently in social media, there's a lot of information about health, but oftentimes the information is not true, not complete, or not backed by scientific facts. Do you think there should be some kind of regulation on social media to avoid misinformation about health and diseases? And I'll add too, what is your role then as high-profile functioning members of the social and digital media world to combat misinformation and incomplete information?
Want me to start?
Yeah, go ahead, Christy.
I think regulation on social media kind of defeats the purpose of social media. That's my initial gut reaction to that. But inaccurate information on social media is also part of the nature of social media, I think. Back when I first started at CNN, you had to have 2 high-level expert sources before you could ever go to air. By the time I got to WHO, the pendulum had swung so much that social media could post anything, and it was like going to a dinner party. You know, you come in with a piece of a story, somebody else comes in with a piece of the story. As dinner progresses, you're batting things around, forming your opinions, getting it more accurate every time somebody else is talking. And that's what social media is. It's to shape things in real time with people. So yes, the people that are experts in certain areas do have a bit of responsibility to help make things more correct, but I don't think you can force that. I think if you do, you take away part of what social media is about. It's something that we struggled with quite a bit in Geneva for that reason, but it doesn't mean that you shut it down.
Yeah, I mean, really quickly, just to pull on that thread a little bit with the example of the Ebola outbreak and something like Facebook or Twitter. I mean, I think the question that Mr. Sanchez was asking is kind of like, hey, in cases of life or death scenarios with public health and, a killer disease spreading, should, what responsibility does Facebook have? Does an organization like WHO put pressure on Facebook? What are we talking about here? I mean, does this need to be resolved in a regulatory framework? But we're probably not, because if we're living in a free society. So, yeah, what do you think?
There's actually a brilliant angle to that. And every time in an emergency, we saw it in Ebola, we saw it in tsunami, we saw it in nuclear accidents. People want to do something. It's a basic principle of crisis communications. You give people an action. If you don't give people an action, they're going to find their own action. And I remember the false cures that start rising every time an emergency happens. In Ebola, it started first with Nigeria. If you drink salt water, you'll be cured. People just are desperate for something. The problem is that can spread, and then you've got people thinking they're protected and they're not. It's one of the things that at WHO we spend a lot of time on in emergencies, is trying to monitor as many different outlets as possible to shut down the false cures that people are promoting. It's not easy.
Yeah, we can probably do a whole other special webinar on fake news and hoax news in public health. But we're going to be wrapping it up. Thank you to our 4 panelists, Marissa, Christy, Dr. T, Tlaleng, and Laci. Could we have a round of applause for them? Thank you.